We need to restore liability. We need to make the vaccine manufacturers legally accountable for paying damages for the harm done to children. Not just from this point forward, but from the first time that they committed fraud. And that goes back a very, very long way. We have an obligation, and they must have an obligation to make vaccines safer, which they have not done. We need to prosecute fraud as a crime. We need to hold those people, those companies, and their successors accountable for the fraud that they have committed. We need to sever the links between federal agencies and the industry. There cannot be this revolving door. We cannot have it that the FDA officials are open to corruption, to bribery, as they are by the pharmaceutical companies. You heard in the movie one of the ex-commissioners of the FDA saying, people think the FDA is there to protect them. No, it's not. It's there to protect the large drug companies. And that is what it does. He was a man of integrity who lost his job soon after that. And the reason that Tony Fauci is still at the National Institutes of Health and has been there for such a long time is because he is the industry's whipping boy there. And everybody else there who has stood up to the pharmaceutical company has gone. That is why he is where he is. We need to separate safety from promotion. You cannot have the CDC, which holds many patents and buys billions of dollars of vaccines every year. You cannot have a vaccine promotion agency in charge of safety. You can't referee your own football game. And so safety needs to be taken away from the CDC and to be put into an independent agency that is firewalled from the pharmaceutical industry. And then we need to get the safety studies that Congress wanted all along, principally the vax-unvax study, which, as you can see from Brian Hooker's data last night, they never, ever wanted to do. They will do anything they can not to do that because they know what the outcome will be. We need to ban direct consumer advertising. Once we do that, the media will have to go back to competing in the free market and reporting real news. Because suddenly, Anderson Cooper's paycheck from the pharmaceutical industry will be removed. That is crucial. There's a single act alone that could disenfranchise the pharmaceutical industry and the media in one simple blow. Conduct baseline safety studies, as I've said. Require placebo-controlled pre-licensure studies. Monitor adverse reactions accurately. Again, you'll have seen from the movie last night, and it is well known, that the agencies commissioned a study which showed that the vaccine adverse events reporting system picks up less than 1% of adverse events. That's what they want. That is the situation that they encourage, because it grossly underplays the true rate of adverse reactions. So we need something in place that captures all those reactions, which, when that is done, and was done by Harvard Pilgrim, to automate this process, to computerize it, then it picked up an alarming rate of adverse reactions. A rate of adverse reactions that would lead almost inevitably, if this were a standard drug, to withdrawal. Compensation of children who've been damaged. This was meant to be swift, generous, non-adversarial, and come down in favour of children who had potentially been damaged. In other words, if there was any doubt, the children should be compensated. The burden of proof should be on the government or the industry to prove that the vaccine did not do it. And at the moment, the burden of proof is upon the parents to prove that the vaccine did do it to a very high degree of scientific certainty, unless it's a table injury. How are parents ever going to do that? And they know this is impossible. Parents are dealing with a vaccine-injured child. They're not scientists, they don't have a PhD, they don't have a laboratory. How can they take on the might of the industry, the NIH, the government, they can't do it. And they know that you can't do it. So the odds are stacked against you from the very, very beginning. That is not what Congress intended. And most importantly, there can never be in medicine, ever again, forced medical procedures, and yet we have. There can be no mandates. It must be for the parents to decide what goes into the bodies of their children. It must be. And for those of you who were at the Q&A last night, you will remember that I was talking about doing away with past political allegiances. This issue at the state level is going to become much less important because mandatory vaccination policy is going to be decided at the federal level, depending on who gets in. If the Democrats take office, if they take the majority, if they take the White House, then there will be a federal mandate. And so the beliefs, the desires, the wish of the state legislature will not matter so much anymore. There will be a federal mandate for vaccines from pregnancy to grave, of all the vaccines that are on the schedule. COVID-19, I said, okay, if that is the case, then the Republicans need to take a polar opposite position. They need, as they have done in every state fight so far about mandatory vaccination, taken the side of those in favour of health freedom, bodily autonomy, and said no, it must remain for the individuals and the parents to decide whether people are vaccinated or not. So in every state where there has been mandatory vaccination law actually passed or attempts to pass it, it has been divided specifically and exclusively on party lines. Why that should be? Historically, Bobby says to me, it's because the Republicans have got their campaign funding from oil and gas and from the automotive industry, which is not available to the Democrats, and the Democrats have therefore deferred to the pharmaceutical industry and therefore have become beholden to that industry and its policy-making process. But if we are going to have that situation, if we are going to consider that we vote for our children and therefore the politicians who are going to do the best for our children, we need an undertaking. And that undertaking needs to be that in the presence of warp speed for a COVID-19 vaccine and no liability for anyone in the supply chain of that vaccine under the PrEP Act, then there can be absolutely no mandate. Either at a federal level, a state level, at a local level, and there can be no recrimination against those who choose not to vaccinate. And just last night, Scott Atlas was called up to the podium in the White House and talked about COVID-19 and said by the spring of next year there will be X million doses available to people. The first responders will be the first in line to have this vaccine made available to them should they choose to have it. And he explicitly said there will be no mandate for this vaccine. And so this is interesting because they are listening. They are listening. He said it not once but 3 times. This vaccine will only be for those who want it. It needs to go further. It needs to be no mandates at the federal level, but do not leave it to local state legislatures to make up their mind, because as you know, in Virginia, for example, they're already pushing for a COVID-19 mandate. It has to be state, federal, local, no recrimination. And I'm going to go on pushing for that right up until the final hour of the election. And you will know that I was listening to Dell this morning, and there was a rally in England, and I was meant to be broadcasting at that rally, and there was some technical difficulties presumably created by the police taking down the cell phone towers or disabling them, but that doesn't matter because I had pre-recorded a message and that went out. So. They were talking about the vaccine trials, the Aventis trial. Apparently, after one case of serious neurological injury, a known vaccine injury, transverse myelitis, which can be fatal, which was the problem that was largely seen with many of the flu vaccines, that is a recognized vaccine adverse reaction in all of the vaccines that are given. You go to the product inserts from the industry and transverse myelitis is there every time. Because of this case of transverse myelitis, the big manufacturers of those vaccines that are currently in trial got together. An investors meeting was held. And it was disclosed at that investors meeting, and just to put this in context, Tony Fauci's language on this has gone from, it was a coincidence, it's so angry. I'm sorry, very few things make me angry. It was a coincidence, went from, it was just a one-off. Just a one-off. What we learned from that investors meeting is there had already with that vaccine been a case of multiple sclerosis. 2 major, serious, life-threatening neurological injuries known to be associated with vaccination caused by that vaccine. That is an extraordinary rate of adverse reactions. That vaccine is dead. It's finished. There should be no way back. But the language then becomes in the media. Sometimes a vaccine can just unmask a condition in someone. Bullshit! I've 30 years of doing this work and talking to people I've never sworn. But I am so angry when I hear this, a one-off. It's a one-off until the next one and the next one and the next one. And I can imagine the conversation that's taking place in that investors meeting about we are going to have to bury this because we put billions into this and we can make billions and we don't care if a few people die, 100, 200,000, it doesn't matter because we are not going to have an orphan drug. We're not going to have an orphan vaccine. And it's more than that, because if this fails, vaccines fail. They've set the stakes so high. They have never been under such scrutiny. The public has never been aware of safety trials to the extent that they are now. The public are watching, and if this fails, then they all fail. Because the hearts and minds of the public, the confidence has gone. And you will not get it back because you've lied to people time and time and time again. You've destroyed careers. You've destroyed children, you've destroyed families, and you've done it all in the name of profit. And all of it came from this insidious act. So, I want to show you 2 slides. Let me see if I can do this. And I made these this morning at, how do I put that on? There we are. This is the rally in London, taking place now. You saw the Berlin rally of 1.3 million people. Rallies across the world. This is what is happening. You are not alone. You are most certainly not alone. The world is now awake to this issue. And so, going into the election, this is what I want you to do. I want the people in this room to club together to sponsor billboards in this state. Yes. I want billboards with this on it because in a recent study that we have done, the defining question that changed the minds of Americans, changed the minds of politicians, was the realization that the industry has no liability. And when they changed that, their opinion on mandatory vaccination shifted dramatically. And they have become, and you have become, and you are becoming a single voter bloc. This is the issue. Because if this process is allowed to continue, health freedom will be gone forever. We will not get it back. So now is the time to stand on this issue. It is the single most important thing that affects the world. People talk about climate change. We need people, healthy people around in the world to protect the planet. Whether you believe in climate change or not, the planet is precious and needs to be protected. We need people healthy enough to do that. We won't have them. If vaccines are forced into us and our children are compromised, so that the future is one of extinction. That is what I want you to do. I want you to make that happen. I want you to make that happen now, and I want people to change their minds and focus on this issue. I'm going to take questions. Thank you very much. Yes, sir.
So in the 1986 Act, it indemnifies vaccine administrators and manufacturers. It doesn't indemnify the organization that mandates the vaccine, the school districts, the child care facilities, the employers. Isn't there a way to sue that organization for mandating an unsafe product rather than trying to constantly go and attack the vaccine manufacturers and administrators?
It's a very good question. Do we have a lawyer? Any lawyers here? Okay, I was hoping we might have a lawyer who might be able to answer that question. A very good question. It's unfortunate, isn't it, that schools have become the enforcers of these vaccines. That they should be put in a position where their job is to educate children, suddenly they become enforcers of public health policy. That's bizarre. Nonetheless, there may be a potential vulnerability that if they were sued, they just say, forget it. We're being sued for something that's none of our business. You're forcing us to do this. You're using our schools as a way of enforcing your policy. We've had enough. That would be a very interesting situation when they could back off. And suddenly the ability to discriminate against children for not being vaccinated by taking them out of school was gone. And I don't know the answer. It's a very good question, and I will ask around about that. Thank you. This lady here, and then this lady here.
Last week, Mitt Romney called for further censorship of anti-vaxxers, and he also said, wouldn't it be great if we could get these anti-vaxxers who make movies of book to debate the doctors and scientists? Do you have an invitation that you can give here, as this is being recorded, to Mitt Romney, as he seems to not believe that you would want to debate a doctor or scientist?
Thank you. Three things to say. I am not anti anything. I'm pro. I'm pro-vaccine safety. I'm pro-science. I'm pro-parental choice. I am pro-no mandate. I am pro. And I take a very positive view of the world. Throughout the years, I have challenged people to debate. I have challenged Paul Offit to debate. I have sent registered mail to Paul Offit and emails to invite him to debate. I have invited the scientists in the film VAT from the CDC who committed the fraud to partake in the documentary, to explain themselves, to render their defense. Not a word. So we have tried time and time again to engage them in debate. The first time a real debate took place that was widely seen was between Bobby Kennedy and Alan Dershowitz, who, while not an expert in vaccines clearly from the debate, is an expert in constitutional law, and it was his position that we have no right to refuse. The government can grab us and jab us and we have no right to say no. And they had a debate. Bobby was absolutely outstanding. It was one of the most important conversations I've ever seen in my entire time. And he killed Dershowitz. Dershowitz kind of backed away. He tacitly admitted defeat. And that is why they don't want to benefit, because they know they will lose. So, and finally, Mitt Romney has to be voted out of office.
Yay!
Yeah, I was just wondering, I haven't followed up on checking how long they're tracking people on these COVID vaccine studies. Do you know what they're...
How long the follow-up is for adverse events? Ideally, for a vaccine, like any vaccine that can incite an autoimmune reaction, you need to follow them up for life. Because that autoimmune reaction might occur a month, a year, 2 years later. Often in autoimmune diseases need some kind of intercurrent triggering event. And then the vaccine reaction manifests. We know that with viruses, for example, so early exposure and later disease. I don't know, but if the historical record is anything to go by, then we have a range of follow-up periods. So for the hepatitis B vaccine that was is now given to all babies in this country on the first day of life, then the safety studies for the GlaxoSmithKline vaccine were 4 days, and for the Merck vaccine were 5 days. So if your child died on the 6th day, it was nothing to do with the vaccine. That is the standard. For MMR, 3 weeks. For viruses that are known to persist in the body and cause disease much later. At the moment, we're not allowed to see the protocols for these trials. We have been denied access, and I was just reading about that this morning. There is no transparency. And so we do not know what their intention is in terms of long-term follow-up. But you can be sure that it will be as short as they can possibly get away with, because they do not want to identify adverse reaction. I think there was a hand down here. Someone had a question. Oh, yes, this gentleman.
Wondering what you know about the so-called COVID vaccine using recombinant RNA, what impact that would have on the body. Can it really genetically modify the human genome and that kind of thing?
Well, the problem with these vaccines, they've not been used in... Okay, sorry, to repeat the question. The recombinant RNA vaccines, these new Frankenstein vaccines that are now being used, do we know anything about them? And the answer is no, we don't. Because they're the first time that they have ever been used in humans, in human trials. We do know that when you use these vaccines, for example, there was a dengue fever vaccine that was trialed in the Far East and is licensed and given to many hundreds of thousands of children. It's a condition that's common there and not common here. But they used a Frankenstein vaccine. They created, with the backbone of a yellow fever virus vaccine, the dengue fever gene was inserted into it to produce an immune reaction. It was genuinely a Frankenstein virus. Scientists can do this in the laboratory, and therefore it's okay. And nature says, actually, no, it's not. Because what happened is when they gave that vaccine, it induced an immune response, good, and there were no adverse reactions. Wonderful. Until the children were then exposed to natural dengue fever virus. And then it was catastrophic. And many were hospitalized, many died, and it was observed as a fact that these children were then liable for life to serious adverse consequences once exposed to natural dengue fever virus. They were a time bomb. The company knew about this beforehand. They knew there were problems, and they didn't tell anyone. They continued to license. And now that company is being held liable. So that is what we do know about these new experimental Frankenstein vaccines. Lady at the back.
Can I just say thank you to you? I knew of you long before I think anyone else in this room back in England. My youngest daughter was born in '95. You were on the news and in the newspapers. Those days we didn't have social media and big phones, right? And what you said about the study you did with the connection of the MMR and digestive issues resonated with me enough that I knew I was not to vaccinate my daughter, who's now 26. Baby had colic and some not major issues, but I absolutely knew that I was being told not to vaccinate her, because if she did, she would have been injured, and I thank you for that. And I feel that you didn't have to continue doing what you're doing, because as we all know, there's people who don't like you. And they don't like Dell and all you others who are truth seekers. And I believe God has put you people in places for you to do what you're doing. And I really thank you from the bottom of my heart.
We're probably almost out of time. I'm going to do something I've never done before. I will take one last question, and it's that lady over there. I'm going to, in order to raise the funds to make this happen, it must happen, I'm going to auction my own t-shirt. I can promise you it's been worn and not washed. And my own hat. So I'm going to give these to Kristen to auction off. Not that they have any real value, but there you go. That's what I can do right now. There they are. And one last question from the lady over there, whose podcast I was on the other day.
Yes, so I will match $2,000 to put this up all across the Wasatch Front. Anybody who comes to me, and I'll prove that I spent the $2,000. So if you guys will come up with $2,000, we can put this up on I-15, probably about a month with $4,000.